Well, my father was a small town doctor, so there was never any question that I was going to be a doctor, but the type of doctor changed quite a bit over the years. I initially trained in neurology because I was interested in the brain and consciousness and the nervous system, but I started to specialize in conditions that had genetic predispositions, and particularly Alzheimer's disease. And I got fascinated by the ApoE genetic risk factor that is a gene for risk of Alzheimer's disease when it was just coming out. And I designed one of the earliest research studies that was funded by NIH to explore whether people wanted this information and how it impacted them. What was the medical, the behavioral, psychological, and economic outcomes of learning genetic information about yourself? And this was back in the 1990s when almost nobody was doing this, and it was very, very controversial before DTC, before anything. And then direct to consumer genetic testing came out. I think the earliest companies launched in about 2007. And all of a sudden, the work that I'd published on ApoE was highly relevant to what was emerging in the world of genetic disclosure, both in the direct to consumer world and in the medical world. And at that point, I thought, wow, this is the most exciting stuff I've ever experienced. So I did something a little crazy. As a full professor of neurology, I went back and did a second residency 25 years after I'd done my first one.
Oh,
And
boy.
that second residency was in medical genetics. I got incredible training from the group at Boston Harvard's Longwood Genetics program. And got board certified in medical genetics in 2011. So an experienced physician scientist, but was rather new to genetics. And then being rather new, I was able to bring some new thinking, different kind of thinking to some of the questions. And as we'll talk about, that's helped me out quite a lot.
You mentioned the early studies. What was kind of the reticence or the hesitation at the time? Was there a prevailing belief that people didn't want this information? There would be some kind of angst of knowing it?
There was, and there still is. The issues around disclosing genetic information have not actually changed since the 1990s. They have shifted.
Hmm.
So I remember before I trained in genetics, I remember approaching a geneticist and asking, hey, why don't we give ApoE back to people who ask for it? And said, absolutely not,
Really?
completely
Wow.
unethical. You should never do that. And I think the concern was that there was a basic public misunderstanding of genetics and that it was highly deterministic in all situations, which of course it is not. That people would hear a risk factor like an ApoE4 variant, and they would assume that they were going to definitely get Alzheimer's disease. They would have catastrophic distress, suicidal ideology. So there was that whole idea. There was a sense that if there wasn't a absolutely direct treatment available, that we in the medical profession should not be talking about these risk factors. That's changed a lot, both because we have more respect for patients who desire information now, and because there are more treatments available now. Um, and then there was a sense that's still true today that there weren't enough geneticists, there's not enough genetic counselors, and primary care docs and others wouldn't know what to do with this information. That's still kind of true today. So it's quite interesting, Rome, because the reasons haven't changed, but they softened considerably over the years. And there's been a set of pressures, both academically from within that I've helped, been one of the people who've helped drive, and also commercially from without, which has been knocking on the door, uncovering markets of people who actually do want genetic information.
I'm going to circle back on that point in just a second, but genomes to people, I've read that the mission is to translate genomics into health, right? And I've read that you stated that you have a vision to bring whole genome sequencing that could incorporate into preventative genetics and genomics into the healthcare system and eventually mainstream medicine to avoid devastating medical conditions. And